All right, welcome back to the show. Security 247 on Equality 9.7 FM, first on your mind. And I will being your host here today, which is Osinake, Child Safeguarding Officer. And with me in the studio, I have amazing personality from Stamp Heart Drug Abuse Initiative. We have Ulua Femi Silas and Blessing Ingbania. We've been discussing extensively on drug abuse prevention, treatment, and recovery. And of course, remember that this show is powered by the Lagos State Government, and we're going to be opening our phone line right away because we want to hear from you on this topic. I know it's a sensitive one. We might not have someone using drug in our homes, but we probably have witnessed a young person or an older person in the environment that have had to add encounter with drug. What is your experience? How do you think we can control this as a society to ensure that we try as much as we can to reduce the prevalence of drug abuse in our communities? Hi, Blessing. Thank you so much for sharing so far. So just moving on quickly, I just really want you to share more on this. I'm going to call the phone line again, 0058975897, and we hope to hear from you. About some couple of weeks ago, I had an encounter, with some teachers. I do a lot of teachers training and try to have conversations with teachers and see how best we can improve our practices as well. And I know a teacher who had shared with me that she noticed some changes in her student over time. She used to be this girl that is very bright. She loved to participate in activities and all of that. And on the contrary, she wasn't like really, really, she was very hyper, but she became a little bit withdrawn. It was later they got to realize that she was using drugs and she was getting mixed up with some very wonderful, let me use that in quotes, new friends. How influential do you think peer groups and social environment is in pushing young people to drug in our community, especially looking at it from the school perspective?
Yeah, very, very influential. Very,
Mm.
very. That's one of the ways in which, young people actually get themselves mixed up in drugs. And then when we go to school, what we tell school is when you have a policy on drug abuse, when you have a policy on drug abuse, let it be corrective and not punitive.
Can you say that
Having
again? Let it be what?
let it be corrective and
And
not
not.
punitive.
Hmm.
Not to punish the user when they are caught, but to correct them, to
Hmm.
pull them in. And the sanction shouldn't be that will keep the child away from school
Hmm.
or keep the child out of school. Beg my pardon. Keep the child out of school, but keep the child in school. Because when you keep them out of school, when you punish them, you're emboldening them. You're giving them a reason why they should probably still go back to it and still rely on it. But what we actually need to do is to sit down and then have in every school ought to have a social worker or a counselor. I know
Okay.
Lagos State has that. I don't know about private schools. So that's where actually the counselor comes in. Have a therapy session with the child. Get to find out what is happening at home. Why did you get into this? Find out what is actually
Yes.
going on. That's when you actually bring the child in. That's not when you label the child.
Hmm.
So you don't lose the child, you don't label such kids, but you bring them in, you interview them, you get to know what's happening. Then you also engage the parent. Depending on what you get from her, you need to engage the parent. There are some kids that probably need to change environment depending where the influence is coming from, and if the environment is actually part of the influence and they can't help it, or probably it could be the school, whatever it is. By the time a counselor go through some therapy sessions or section with such kids, they will know the best way, to
To
help,
handle
yeah, to handle
to help
such kids and help such
help the
child.
child. All right, 0058975897. Our phone line is open, and you can also send us WhatsApp messages on 0058975897. Would love to hear from you. How do you think we can control drug abuse in our society, in our community? And remember, this show is powered by Lagos State Government and in our abilities, and of course, are part of our efforts to ensure that we create a sane and safe society. You mentioned something about not having the child out of the school. And I really like, for me to speak to that because I know that we've had cases where, something like that is blown out of proportion. And other parents get to know that, oh, there's a child that is abusing drug in the school environment. We don't want this child to also mix up with our children. In such a very sensitive case, how do we help that child? Would you advise that we still keep the child in school while the child is going through help? Or we just look at the measure of it and try to separate the child because, like I said, it could be blown out of proportion. Maybe the school didn't handle it properly. How best can the school handle such situation?
Okay, before I come to your question, let me read from there is a law called the Child Rights Law of Lagos State.
Okay. Yes.
Section 22 of the Child Rights Law of Lagos State, subsection 1. The heading is exposure of a child to the use of any psychotropic substances. Now, let me break it down. Psychotropic substances, they are drugs. Psychotropic substances, they are drugs that when you take, it affects your mind, your emotion, and your behavior. Now, this law states that a person must not employ, expose, or involve a child in the production or distribution of narcotic drugs and drug psychotropic substances. Now, I want you to pay attention to subsection 2 of the Child's Right Law of Lagos State. It said the person must not employ, expose, or involve a child in the use of narcotic drugs or psychotropic substances. So it is against the law to send a child to go and buy illegal drugs or even prescription drugs. So let's establish that first.
Very important.
Now, when a child has started abusing drugs,
Yes.
the first thing to do is to seek for professional help. You need to take that child to the hospital to see a medical doctor. Now, the doctor will assess the child and draw out a treatment plan for that child. Now, part of the treatment plan is that they has to carry out what we call drug urine tests.
Okay.
That will determine the kind of drug. It will show the kind of drug the child is abusing. Then from that level, they have to carry out other medical check on the child to know the extent of damage that drug has caused to his body. They have to carry out X-ray, do hepatitis B and C test,
Okay.
HIV test, check the lungs and the heart, the kidney. Now, if the child has been abusing that drug for a long time, because these are some of the health consequences of drug abuse. So after that, in Lagos State, we have the Lagos State Rehabilitation and Vocational Training Center under the Ministry of Youth and Social Development at Sherry. Now, after the doctor has assessed the child, he can now recommend him for rehabilitation.
Okay.
But that will now depend. In Lagos State Rehabilitation and Vocational Training Center, if you are below 22 years, they will not take you in. So they can either take the child to Federal Neuropsychiatric Hospital at Yaba, or other private rehab center or faith-based rehab center, recognize one and register.
Yes.
I'm talking about authentic one because we have a lot of fake rehab centers around. So from there, then the treatment will start with the supervision of social workers, clinical psychologists, and other. But if the child is above 18, a child under the law is anyone under the age of 18.
Yes.
But if the person is above 18, then he can go to rehab for adults.
How accessible do you think this information that we're sharing is, to schools and communities and individuals?
On our part, we've been to many CDAs. We engage the community.
Okay.
We try to educate them when they have a child abusing drugs, the steps to take.
Okay.
We also dish out information that will help the community and even the CDA. This is very, very important because at the community level, you have a lot of people abusing drugs and they don't even know how to go about it. The community don't know how to go about it. The family members don't know how to go about it. So we try to provide them with basic information, what to do when a child is abusing drugs, and even adults too. We give them all the necessary information, how they can access rehab center, the hospital to go, and other relevant information.
Oh, interesting. Well done to you and your team once again, and kudos on all your efforts to curb, drug abuse in our communities as well. There's something here that I really want us to talk about, and this was like an argument with some group of teenagers that I had a session with a couple of weeks back. Now, countries like Netherlands, Colombia, Argentina, Jamaica,